Good evening to all. Allow me to take a few more minutes of your time to present to you the draft plans of AHIN. First of all, thank you to our network of network panelists and also to our marketplace presenters and partners who shared with us what their plans are for the next 3 to 5 years. We really appreciate your comments and statements about supporting our call to action. That's very important to us. So allow me to just give you a quick recap of the past 4 weeks. We launched our call to action, basically asking our partners and governments and private sector to fill the gaps, make sure that we have governance, a multi-sectoral coordination mechanism. We have an architecture or a shared enterprise blueprint. We have program management, standards, and interoperability. And on day one, we had two batches of countries sharing their experiences with digital health and in the pandemic. On the second week, we had our partners present what digital health solutions they have done together with Ministries of Health and what have been their challenges and successes. That helped us a lot understand what's been going on in the region for the past 2 years. We also asked a survey on the third week on what activities would they want AHIN to continue, and we got a lot of responses on the building and strengthening the community of practice, followed by our webinars and certification trainings. We also had presentations from our partners like GIZ, Government Foundation, PATH, WHO, and Fundacion PEPA. And just a previous hour, we had a network of networks meeting where we heard digital health networks from other regions, not just in Asia, listening to what their plans are and looking forward to what this network of networks will be able to do in the next few months. So just to reiterate, the vision and mission of AHIN are interoperable digital health systems for universal health coverage and health systems in Asia, promote learning, resource sharing, and knowledge exchange to strengthen digital health through the networking approach. In the short term, these are the activities we hope to do within the year. Have some training on standards and interoperability, a data governance workshop, enterprise architecture training, a convergence workshop, at least one or two, if we can do it in two countries, ICD 11 training, PINS2 training, digital health leadership programs, and webinars on vaccine management, medical tourism, and scaling COVID-19 applications to national level. In the long term, we'd like to propose this draft. We have thought about this for in the past 4 weeks. It will still need to be vetted by our working council members. The working council members of AHIN are the national digital health focal points of the countries. And we hope that by the end of 2023, AHIN should be able to expand the network through partnerships with other medical schools and networks. Right now, we are testing the waters, so to speak, with the youth. I think we're getting old, so we need to have more young blood into AHIN. So we're partnering with student networks such as the Asian Medical Student Association, Philippines, the Association of Philippine Medical Colleges, Student Network, and hopefully once we understand how to engage and bring them over, we can also extend the same AMSA and Medical College Network in other countries of Asia. In the future, we hope to create a network of these medical universities from different countries, having a university-university collaborations, and encourage medical universities to partner with their respective government agencies, university to policymaker for knowledge dissemination. We hope to expand the network through partnerships with other digital health networks. We already had that session with the network of networks, but we also want to support the ASEAN member states e-health technical working group, which recently had their meeting and for which Dr. Eric Tayag, Dr. Fazila, Dr. Chancelly, who are also members of the AHIN Working Council, are members of the e-health technical working group. We hope to formalize the appointment of the members of the AHIN Working Council. Right now, they are volunteers, and thank you very much for your support. This is the group of national digital health focal points advising AHIN on our short-term and long-term strategies towards interoperable digital health systems for UHC and health systems in Asia. We hope to define a formal process for working council appointment and establish formal AHIN country chapters in support of the working council members. We hope to establish AIN's position as a thought leader in digital health implementation in Asia by forming a repository of digital health implementations in the region. And the marketplace has helped us a lot gather that information. So we hope to publish that, all of these AHIN efforts, map them according to the Mind the Gaps framework, activities that help country lay digital health foundations, lessons that they've learned that they're willing to share with other countries, create a compendium or a guidance on what worked and what did not work in their digital health implementations, and the development of a digital transformation toolkit to support or comply with the WHO Global Digital Health Tools. We hope to expand the AHIN Hour and general meeting topics at the policy level by inviting policymakers to present their national digital health plans and updates. We hope to strengthen and keep regular our AHIN hours and GM sessions with digital health policymakers as presenters. I'd like to thank Charisse and Christine for helping us continue our AHIN hours, and thank you for Dr. Phim and Azurin for joining the Secretariat. We hope to fill the gaps at the regional level by conducting training needs analysis and other assessment methods. We hope to create a process for AHIN's training needs assessment and workshop design. We hope to engage with ministers of health in different countries to support MOH-led convergence workshops. And here we hope to help our countries bring together the other sectors behind the e-health leadership of the Ministry of Health, again using the GAPS framework. We hope to support digital health programs intended for the implementation of CRVS and people identity. And here, we are looking at delivering training on CRVS with support from our partners like UNESCO and WHO. Offer long-term digital health programs like scholarships for digital health-related courses, masters, and PhD. We are currently, this is ongoing right now with Mahidol University, and we hope that more masters and PhD graduates will come forward. We want to offer short-term digital health programs, scholarships for certification like what we did with the MIT Critical Data, and develop more certified individuals for digital health courses like data science. Partner with universities for co-creation of digital health curriculum with hands-on opportunities for medical students. Create a digital health curriculum with OpenEMIS as our lab component, either using Moodle or another platform. And conduct training on health data governance by creating a program for health data governance, including SDG data. A few more slides. Develop a reference enterprise architecture for health and create a strategy for enterprise architecture with timelines, resources, toolbox for the countries, especially strengthening the Regional Enterprise Architecture Council for Health. These are the certified enterprise architects from the MOH and volunteer consultants. Create opportunities for consultation with AHIN mentors in digital health strategies by conducting consultative meetings with ministries of health upon request, providing international mentors to them, ranging from enterprise architects to program managers, support countries in their digital health strategies, and how to bridge with the establishment of interoperability labs, support mentorship, business cases, practical implementation and resourcing, and identify essential minimum digital health platforms, as well as basic building blocks of health information systems for the region, and agreed by the stakeholders to implement in a framed time. Basically, we'd like to help the MOH look at repositories and resources that they can easily reuse. Create an e-learning platform for AHIN as an accessible medium for digital health announcements, courses, resources, and knowledge exchange, and later on launching this AHIN e-learning platform. Recalibrate AHIN's digital health communities of practice. And here I'd like to mention the Community of Interoperability Labs, or COIL, the Regional Enterprise Architecture Council for Health, or REACH, the OpenEMIS Community of Practice, and the AHIN Research Group. And hopefully these groups can also fly on their own, have their own secretariats, and create a community behind each of these topics. Initiate interdisciplinary collaboration in the field of digital health in the region through research activities, um, encouraging them to do gaps-oriented research to see how we can further strengthen GAPS in each of the MOH countries. Finally, promote regional implementation of HL7 FIRE for interoperability, conducting STRAC, standards track on convergence workshops, and engaging existing HL7 chapters in each country through the HL7 International. Demonstrate an interoperable national digital health system, including registries and regional interoperability through the demonstration of interoperability of vaccination data in our general meetings. Support the formation of standards and interoperability labs in countries with national conformance testing capacity, increasing the number of countries with in-country interoperability labs, aligned, of course, with the country's digital health strategies. So that's a lot. And the last few slides are statements coming from some partners who were able to send this just before our today's meeting. From Transform Health, AHIN will be working with Transform Health, a coalition of organizations dedicated to achieving UHC in the digital age, and PATH, a coalition member and longtime AHIN partner, to develop a set of global health data governance principles. These principles will be developed with input from a series of regional workshops, including one that AHIN will be organizing and facilitating to collect and elevate perspectives and experiences from South and East Asia. We will be sharing out more information about this important work via the AHIN mailing list in the coming weeks. From OpenHIE, Dr. Paul Biondich, believing that there's significant opportunity for collaboration, specifically OpenHIE's mission to help countries recognize effective, sustainable information exchange. So the focus on gaps within the call to action is highly aligned with the OpenHIE efforts. As such, OpenHIE is willing to provide all of our resources, subject matter experts, artifacts, tools to AHIN members as our commitment to the network. Additionally, we recently established an OpenHIE steering committee, 100% comprised of health leaders from countries we intend to serve, including our own leaders from AHIN. We consulted with AHIN during the formation of this committee, and I'm pleased to say that we've placed multiple members into the steering committee based on AHIN's recommendations. Thank you, Dr. Paul. Congratulations. And from our friends at ICD-11, in line with its capacity building program for standards, AHIN will establish the ICD Community of Practice in preparation for the ICD launch in January 2022 and in anticipation of the increased interest for accessible standards from the community. AHIN will register ICD in its Enterprise Architecture Repository through the Regional Enterprise Architecture Council for Health, and once it's there, we will pass it on to the community of interoperability labs to embed into their interoperability laboratory. From WHO, CRO will work with AHIN to initiate PRINCE2 online facilitated training and certification for 40 foundation level and 20 practitioner level. Hope to do this around February, March, or May. And from WIPRO, support AHIN's activities to improve capacity on HIS development, including training on ICD-11, CRBS, and looking for ways to improve digital health governance and related tools in the countries. And that's a long list of strategies. And don't forget, these are draft. What we will probably do is get more inputs from you, the audience, and consolidate them. I think there are too many. We could probably not do all of these in 1 year or 3 years. But I think with the consolidation and working together and thinking through what are the strategic items, we could come up with a few very strategic areas around governance, architecture, program management, and strategy that we can all work together for the next 3-5 years. So I'd like to open the floor now to Dr. Bunchay, Dr. Fazila, or anyone in the panel who'd like to add. Jai, go ahead. You raise your hand, Jai?
No.
Okay. All right. Anyone else? Dr. Fazila, Klube, Dr. Bunchay will have the last say because he will also say thank you and goodbye to everyone.
Yeah, can I say something?
Sure, go ahead, Dr. Fazila.
Yeah, very good evening to everyone. Tonight is our closing ceremony, and as you know, the team strengthening the regional health system response to COVID-19 is actually very much relevant in this unprecedented time. And I'm sure throughout the whole month on Thursdays that we have heard, the laying the foundation as described by Mind the Gaps is actually very important. So again, I would like to call upon all of you to support the call of action to strengthen the regional health systems by improving our governance, specifically in developing national health strategies, have a clear architecture and blueprint for interoperability and secure data sharing, strengthen the capacity and capability of national program management, and also collaborate with regional partners to facilitate learning. And finally, we must all have open access and technical assistance to international health standards, which are crucial components to interoperability blueprint. So with that, let's work together with us in AHIN and bring digital health to the next level in our region. Thank you.
Thank you, Dr. Fazila. I'd like to acknowledge the presence of Lube and Ms. Ai Sain, who helped us with the statements coming from the ministers and secretary of health from their respective countries. Maybe Klube, say something brief, a message to the community, and then I'll call Ai, Jai, and finally Dr. Bunchay.
Thank you, Elvin. I'm congratulations to AHIN for the successful organization of the general meeting, and I hope that in the future, Hong Kong side could contribute more on the activities of AHIN, especially the experience and also the standards, and also all the past the standards project experience and also know-how to all the community and the global family of the AHIN. Thank you very much, Dr. Bunchay, Jay, Elvin, and Vasila to lead us in the past few years for the great success of AHIN. Thank you very much.
Thank you also, Klube, for helping us in Hong Kong. Don't forget, I think the interoperability lab in Hong Kong is something we can work on in the short term.
Yes. Okay.
Ai, you want to say something? Okay. Maybe I'll call Jai.
Hello, Erwin.
Go ahead, Ai. Go ahead.
Yes. Thank you. I would like to extend. I would like to extend my sincere thanks to all of you to organize this 7th AHIN General Meeting and also allow us to participate all the 4 sessions of AHIN General Meeting. Thank you so much, Erwin.
Thank you very much.
We have learned a lot from the AHIN 7 meeting. Thank you.
Thank you. We're always here for you, Ai. When we started AHIN, Myanmar was, trying to catch up. Now everyone's trying to follow Myanmar. So I hope we can have you in one of the webinars talk about some. Thank you, Ai.
Thank you.
Jai, and then Dr. Bunchay.
Thanks, Alvin. I would like to thank all my colleagues here in the governing committee of AHIN and the secretariat, and especially our partners without whom we could not have traveled this far. I would like to express our heartfelt gratitude to all the partners who have been with us, been supporting us continuously, and made this journey possible. And then I would also request the members. It's about like something that what we have done for the network. That's one part of it. At the same time, the network consists of each and every one of us, including you. So it will be good to hear if you can come forward and then say what is that you can contribute. Each one of you can contribute to the network. Come up with fresh ideas. Come up with even criticisms that we shouldn't do something or we should start doing something. Those kind of things are very much welcome. Please reach out to the secretariat, and you have this email ID available in the website. Please do reach out to us, and then that's how the network will grow. And network consists of all of us. Thank you very much.
Thank you, Jai. And our boss.
Thank you. How can I say? I think this is our good experience on convening the general meeting virtually. We, as Dr. Faisal from Malaysia said, we have a new motto that we are in the same storm but in different boat, which is that the digital development also maybe implementation may be different, but we are in the turbulence of the changing of the world. And because of we are in the storm, that's why friends is very important. So when we give a hand and we will help friends, then would we come and help us? So that is what the two things that I got from our general meeting. I would like to thank all of the this very hard work of the AHIN Secretariat, Philippines, Thailand, Malaysia, especially Christine and Cha from Malaysia, from Philippines, that do a lot of work on organizing this, collaborating, do all the work that the general committees asked to help. And I also would like to thank all the general, all the GC, the general committee, Dr. Alvin, our executive directors, the leader, Jai and Fasila, and all of the working council. I don't know how to thank you that you are the minister of the Ministry of Health and Sport from Myanmar sent a very kind of the good message to our Asia and also to the world. I think now you are the leader, Myanmar. You are not just the follower. And this time you have to be help each others. I mean, give the hand to the other. Previously, the last 11 years, maybe you ask friend allow you to help you, but right now you have to help friends, and you learn more from that. So to that, how we gonna close this general meeting? I would like you to close this as formally as we can. So, but this is I don't know. It's a very good experience. We should document and learn from this experience.
Yes.
Over to you.
Can we see the secretariat also? Maybe we should
Yeah.
have a group go and close this.
Secretariat, can you appear while they are?
If you are comfortable.
You got them by surprise, Jai. I think it's been a long 4 weeks, a long day 4, and I'd like to say good night to everyone. When we help friends, friends will help us. And now we are in the same storm on different boats. I think this is really the best time for us to start using our friendship, because this is a very difficult period in all our lives, all around the world. And I think it is the bonds of our friendship that will get us through this together. So thank you very much. The meeting is adjourned. Thank you for joining the 7th General Meeting.
Thank you very much. Thank you, everybody.
Bye.
Good night, everyone. Bye.
Good night.
Bye, Klube.
Good night. Everybody, good night. Bye-bye.
Bye, Klube. Bye,
Bye-bye. Everyone, bye-bye, Punchai. Bye-bye, Jay.
Bye,
Bye-bye. Bye-bye.
Bye-bye.
Thank you, everyone. Very nice to see you all.
Yeah.
Very nice to see you all.
Bye-bye.
Bye.
Bye.